Wonderful. So we're so delighted to welcome Naïma and Janet to speak with us today. I hope many, many more people join. Someone was really enthusiastic and put the link on Twitter, and then our IT department and Zoom told us that was a bad thing because apparently we can be easily Zoom bombed. So that was why the link changed. So we may have some stragglers coming in, and they're most welcome. And of course, this will be posted on our YouTube channel. So I'm going to introduce our two speakers who are both researchers and advocates. And I was saying to them, we've all been asleep at the wheel and not really looking at what is happening in our midst. But fortunately, they've been very active since the summer, trying to tackle this important issue that we'll be talking about today. So Naïma Bentayeb is a PhD and in-house researcher at the SHERPA University Institute, and she's an adjunct professor at McGill's Department of Social Work, and she holds degrees in public administration and program evaluation. And so she conducts research and evaluation that addresses structural and systemic issues related to immigrants and community and institutional responses to the needs of this vulnerable and new population. She's interested in youth protection, mental health, and how ethnocultural background interplays with health and systemic issues. And she advocates a developmental and participative approach. Janet Cleveland is a researcher also at SHERPA. She's also a McGill professor, and she has degrees. This really impressed me, Janet: psychology, anthropology, and law. So, you know, I don't know how many years that was cumulatively. And so since 2003, she's conducted research on the impact of public policies on the rights and well-being of precarious status migrants, with a focus on access to health and social services. So Janet and Naïma are going to talk to us about their research in this area, and then their response when a real, quite a big barrier to health emerged through the proposed Bill 96. So I welcome you both.
Thank you.
So thank you for the invitation. We will begin. So before discussing the linguistic barriers, interpreters, and the impact of B96 on the accessibility and quality of health and social services, we wanted just to acknowledge that our work in Montreal takes place on the unceded Indigenous lands, known as a gathering place for many First Nations that we recognize as custodians of the lands and waters on which we gather today. So the seminar today will be dispatched on two parts. The part one, I will discuss with you the linguistic barriers, the accessibility, and the crucial role of interpreters in Quebec health system. And Janet will explain the potential impact on accessibility and quality of health and social services linked with the B96. So let's begin with the part one. And I want you to imagine yourself alone in a place with no way to communicate with the people there, no way to get answers to your questions or needs just because you don't understand or you don't speak the same language as those people. And imagine that this is the daily life of many immigrants. We count more than 1 million of immigrants in Quebec based on the 2016 Canada's census use. And in Quebec, where the majority of the population is French speaking, 70.5% of immigrants reported having another language as their mother tongue. And from those immigrants, 39% speak at home their immigrant language. So the majority of immigrants have difficulty accessing healthcare services due to their lack of official language skills. And it's fact that is supported by many researchers and studies. For example, a poll of medical telecommunicators conducted with Mishkish and colleagues in 2010 reported that 62% claimed misunderstandings made it difficult for them to treat patients more than once a week. And around 80% of dispatchers said communication challenges kept them from rapidly resolving limited English proficiency at least once a week. And it's the same picture from the perspective of nurses in another study in 2006 deployed by Nilan. And nurses have also expressed worries about the timeliness of care and the delays that come with not having interpreters on hand, and as well as the possibility that their efforts to help immigrants will be misinterpreted if they don't have a clear understanding of what care entails. So currently in Quebec, there is no central government structure for the management and coordination of interpretation services. So practitioners and users attempt to communicate using whatever mechanisms are available to them. Evidently, professional or ad hoc interpreters is the most mechanism, but sometimes some mechanisms are used and are mostly prescribed by empirical research. For example, Google Translate, general documents in other languages, or even gesture. For professional interpreters, interpretation services are provided by a variety of actors. So there are some community organizations, and there are 2 interpreters banks in Quebec. But practices are not harmonized and are sometimes even not known by other institutions and within the same institutions. Two facts that are interesting for the 2 banks of interpreters. The one located at Montreal is coordinated by the CIUS of Centre-Sud, and the one in Quebec City is coordinated by the CIUS de la Capitale Nationale. But it's interesting to mention that interpreters are self-employed and therefore have no obligation in terms of performance or outcomes like the MSS employees. The other fact that is interesting to mention is that since June 2021, the 2 interpreters banks are exclusively reserved for the health and social services network. So with the other ministries and government services, even if they work with immigrants, they don't have access to the 2 banks. For example, the MIFI uses the Bank of Interpreters of the community organization Service d'aide aux Néo-Canadiens, and the Ministry of Justice deals with the Ordre des Interprètes. In 2018, the ministerial orientations about interpretation were published, and the aims of those ministerial orientation was to create a Bank of Quebec interpreters for the health and social services network. And the leadership will be provided by the Montreal Interregional Bank in collaboration with the one in Quebec City. The new bank will be theoretically responsible for offering insured interpreter services to all regions, to give one-site or remote services depending on different regional realities, and manage interpreter training as well as training for providers regarding the use of interpreters for clinical intervention. Even if the use of interpreter is well documented and is really interesting and provides positive impacts on users, it is not always possible to access a trained interpreter. And when they are available, sometimes it can be difficult to access an interpreter with experience on the desired field of intervention, for example, in mental health or oncology, and who is well versed in the consumer's preferred languages or even dialects. Studies show that some consumers even have difficulty accessing an ad hoc interpreter. Donc, it's complex for users to find a member of their family or social network who is available, and sometimes immigrants didn't have yet a network in Quebec. And this situation places responsibility on the user to fill a gap in the healthcare system and create eventually undesirable delays in the use of healthcare services. Let's see some preliminary results from research about the intervention with the interpreter during the pandemic. The results presented here are about the situation in normal context, because we have asked respondents compare before and during the pandemic, and the results came from a quantitative part of a research funded by CRCF of McGill, CERDA, and SHERPA, and aimed to document the issues encountered by health and social services clinicians working with allophone population and identify the practices used or the innovative practices they developed. To respond to those questions, we conducted a scoping review and developed an online questionnaire. The data collection have been conducted between October 2020 and October 2021 across 11 institutions in the Health and Social Services Network. 521 clinicians and 103 interpreters participated on the research. And as you can see in this chart, professionals use interpreters for a variety of programs and services offered, and it is particularly interesting to see that programs for youth at risk, including child welfare or youth protection, top the list, followed by general physical health and mental health services. The same question was as well asked to interpreters, and mainly the same programs and services were pointed out by those participants. We also asked our participants about the populations with whom clinicians use interpreters. And we can see that service users between the ages of 25 and 63 are the population for which clinicians use an interpreter most often. Interpreters are less likely to be called to work with younger people. So 20% of providers call upon them for children under 12 years of age and 13% for 30 to 70 years old. The assumption is that these young people can express themselves fairly well or even very well. For the 80 to 24 years old, 70% of the providers request an interpreter for these interventions, and we assume that these are young people who have just arrived, sometimes are accompanied minors who didn't speak nor French or English. And finally, only 17% said they use an interpreter for the population age 64 and over. We hypothesize that these are people who may be accompanied by family members or friends who act as interpreters. If the user, theoretically, if the user has an appointment, it is up to the institution to provide the interpreter and to pay for it. During a few workshops we did in 2019, clinicians pointed out that this rule is not always respected. So we asked our participants, what if no professional interpreter is available? And users sometimes have the added stress of having to find an ad hoc interpreter mainly. So according to our study, when clinicians don't have access to a professional interpreter, 50% of our respondents report using gesture or simple language. Language reference tools like Google Translate or other apps and graphic materials are the next two most used strategies at 19% and 14% respectively. And a fact that is interesting, although only used to a minimal extent, 3.5%, it is important to note that clinicians sometimes use family members, friends, or colleagues, but also young children. So when there is no interpreter and the situation is urgent, users tend to have family members under the age of 18 to interpret, which is not advisable given the negative consequences that these situations can have for this youth and for the parents. As a part of a qualitative component of our research project funded by the Healthcare Access for Linguistic Minorities Network, we are conducting one-on-one interviews with interpreters, clinicians, and users in Montreal and Quebec. We were targeting 60 interviews, but currently we have already met with 18 clinicians, 16 interpreters, and 3 users. to better understand how health services are provided to allophone users and try really to improve those services to allophone families. And according to the data we already analyzed, the conclusion is unanimous. Language barriers affect the quality, the accessibility, and the equity of access to care. Through the interviews already conducted, workers and users insist on the communication difficulties they encounter in the absence of an interpreter. And interpreters and users emphasize the lack of cultural adaptation of the services offered. So this context makes the user uncomfortable and could eventually have a negative impact on the care process. Participants as well recommend that it is more than important to promote the requirement of workers who are themselves allophones and to train professional interpreters to facilitate access to services. So the conclusion is that having an interpreter is not a luxury, but a normal adaptation to the diversification of society. And in a study conducted by McGill and colleagues in 2020, they mentioned that increasing interpreter services is associated with decreasing readmission rates and length of stay for vulnerable consumers. So higher patient and healthcare provider satisfaction is linked with the presence of interpreters, and users who don't have access to an interpreter are less satisfied with the services they receive and are less likely to return to the same points of services when needed. Interpreters can assist professionals in explaining diagnosis and treatment to patients. Their presence can also bring comfort to patients undergoing stressful procedures, and they can assist with discharge procedures. In the other side, poor communication affects the relationship between the practitioner and the user and causes stress for both parties. Some positive results mentioned in the literature is overall a better patient outcomes and improved care services and increased patient understanding of diagnosis and treatment. And more generally, using interpreters can enhance the feeling of inclusion in the host society, positively impact the immigrants' experience because they feel more respected and better understand the administrative culture of Quebec, and finally establish a band of trust between the immigrants and the government. So few references to go further. We will maybe share the PowerPoint, and I will let Janet go with the part 2 of our presentation.
Great, thanks very much, Naïma. So next slide. So Bill 96 is what I'll be talking about. As you know, it's a really major reform of the Charter of the French language. The bill itself is over 100 pages long, multiple domains, very complex, but I'll be talking about one very specific part of Bill 96, which is the provisions on communication between the administration, so-called, and individuals, and more specifically, the potential impact on accessibility and quality of essential public services, and particularly the in health and social services. I'd like to say that this, I'm a lawyer by my initial training. A number of other lawyers worked on the analysis. It's never, absolutely certain until the bill is actually in place and is actually being applied. But we've spent a lot of time on doing the analysis, and we think this is the most probable interpretation that I'm going to share with you. So next slide, please. So where is it at? These are the stages of adoption and implementation of the bill. It's currently at the stage of being studied by a parliamentary committee. They just started and have had a few days of sittings, deliberation, and it will be, they're adjourned, they're going to resume in early February. Basically, it's a group of about a dozen MNAs of some of the government and some from opposition parties who are sitting in a committee room and going through the bill article by article. And opposition parties at that point can submit amendments and try to persuade the government to agree to them. It's not highly likely the government will agree, but there is a possibility at that stage. And then after that, it'll be sent back to the National Assembly to be voted on, to be adopted. And of course, it will be adopted because it's a majority government. And then following that, there will be adoption of a national linguistic policy by the Minister of the French Language, Simon Jolin-Barrette, and his team. And then that will be adapted more specifically to different sectors. For the health sector, it'll be at the level of the Ministère de la Santé et des Services Sociaux that the policies will be implemented or set out. Next slide. So what does Bill 96 say about public sector communications with individuals? So the basic overarching principle is that French will be the exclusive language used, or the sole language used by the administration, unless subject to specific exceptions. So in other words, will be prohibited to use other languages than French, except where explicitly permitted. And that includes use of interpreters. The administration is defined very broadly. Essentially, it's the entire public sector. So not only the civil service, but also health and social services network, schools, CEGEPs, municipalities, and so on, the entire public sector. So what are the main exceptions to the rule of exclusive use of French? It's when services are provided to the following categories of people. So the first category, people who attended school in English in Canada. It's not clear in the law whether it's only elementary school or both elementary and high school, but at any rate, basically people who attended school in English in Canada. Second group, people who communicated solely in English with the institution or agency before the bill was introduced May 13th, 2021, but only for subsequent communications with that specific institution or agency. Third group, quote unquote, Aboriginal individuals. Fourth group, immigrants, but only during the first 6 months after their arrival in Quebec. And finally, where health, public safety, or the principles of natural justice so require, I'll be returning to what that means. The other big exception is recognized bilingual institutions, and I'm going to explain that in the next slide in a moment. So in the Charter of the French Language, Bill 101 initially, for a very long time since the beginning, there's been institutions that have been recognized as having bilingual status, including in the health system. So at the bottom, you have a list of some of the institutions. So there's the CIUS de l'Ouest de l'île de Montréal, the CIUS de Centre-Ouest de l'île de Montréal, the MUHC, and a number of other institutions across the province that are listed at the website that's shown here. So in these recognized bilingual institutions, will retain the right to provide services in English to all English-speaking persons. So instead of being limited to people who did their schooling in English in Canada, for example, it's really all English-speaking persons in the recognized bilingual institutions will be able to receive services in English. However, for other languages, even in recognized bilingual institutions, under Bill 96, it would not be permitted to provide services in languages other than English or French, unless the person comes under an exception. So, for example, immigrants during the first 6 months after their arrival in Quebec. So that's the situation. Next slide, please. What about independent professionals? So Bill 96 applies to institutions and their employees. So people like almost all physicians who are not employees of the health system would not themselves be subject to these provisions. So physicians, so far as we can tell, would be free to use the language of their choice with their patients. On the other hand, they would not be able to use interpreters paid for by the health institution. Again, unless it's a person who is covered by an exception, such as an immigrant who has been in Quebec for less than 6 months. And of course, for employees such as nurses or social workers or whatever, they are subject to Bill 96, so would be restricted to the provisions of Bill 96. Next slide, please. What about the exception that says where health, public safety, or the principles of natural justice so require? And actually, members of the opposition parties that we've talked to have sort of said, oh, well, maybe we don't really need to worry about the health sector because of this exception. Our analysis, and we've had a lot of time looking at it and sort of discussing back and forth, but our very strong impression is that it would not be broad enough to, if it were intended to cover all 300,000 employees of the entire Quebec health and social services system, normally it would have to be much more explicit than it is, especially because in law, the exceptions are, the general principle of interpretation is that exceptions are to be interpreted in a strict manner, not in an expansive manner, because they're exceptions. So in the case of health, what does health mean here? Undoubtedly, it does mean that emergency situations are undoubtedly very highly likely. So 911, an ambulance, somebody coming to pick you up in an ambulance can very likely talk to you in whatever language is necessary. But what else and who decides and at what point is it decided remains entirely unclear. The same thing, public safety, generally the term covers things like police services, very likely also public health emergencies. But beyond that, we don't think that it would be of any help in the health and social services sector. So the problem remains. Next slide. Immigrants, why the government decided on that it would be only during the first 6 months after arrival in Quebec that it would be permitted to speak with them in languages other than French or English in bilingual institutions is not based on any evidence, on any studies, any kind of science related to the time required to learn French. It's not my field, but my colleagues who are specialists in the area assure me that even for children, studies indicate that to reach full fluency can take as much as 7 years, depending on the initial age of the child. And for adults, of course, it's much longer, generally speaking, and particularly can be even longer for people who are older, who have low literacy, cognitive limitations, whose first language is very different from French, who have mental health difficulties, and so on. And even for newcomers who are reasonably fluent in French, when they're in a high stress, high stakes situation, particularly, of course, when they're ill or their child is ill and they're meeting with a physician or with a healthcare provider, it's a high stress situation. So often they'll be less able to understand and to communicate. And the same tends to be true for other essential services. You can think of parents meeting with teachers or with health, education professionals when their child has difficulty at school, a very stressful situation, and really important for parents to be involved and to be able to consent to whatever the services are that are being provided and be able to know what they need to do to help support their child. Situation of workplace accidents or hazards, if the worker needs to either apply for benefits or perhaps meet with an inspector, and again, or for individuals who are applying for essential income support benefits. So all situations where a lot is at stake and the person is in, under a lot of stress because it's a difficult situation. So next slide. There's an issue I won't go into too much, but we don't yet know, of course, how people would go about proving that they're eligible for services in languages other than French, especially when we're talking about, somebody walking into a hospital or a social worker, CLSC or social worker's office or whatever. Or let's say the criteria for a person who attended school in English in Canada, normally the way to prove that is to have an official letter from the school board. Well, most of us don't walk around with that in our pockets. It actually takes a fair amount of time and effort to get a hold of one. We don't know yet. I mean, this is something that it will come later on, presumably, how exactly these exceptions will be monitored, but it's a big question mark. Because of course it can have very real impact on ability to access services, is to be able to prove ability to, or eligibility for services in languages other than French. And so on for the other examples. And just at the bottom of the slide, one thing that's also important to know is that the Bill 96 has a provision that says that failure to comply with Bill 96 will entail disciplinary sanctions. That's in the law, so it's not optional in the sense that what exactly the disciplinary sanctions will be presumably defined later on at the implementation stage. But it's concerning also because, one can imagine easily that a team in a CLSC would say, okay, that's what the law says, but we're in our little team, we're going to talk to people, in whatever language. But if there's, if anybody on the team is concerned about disciplinary sanctions, well, of course, that can have a chilling effect. So that's also a concern that we have. Next slide, please. In terms of the potential clinical consequences, Naïma in her presentation has given a bit of a sense of that. I unfortunately don't really have time to go into it, but I think all of us can easily, we already know, there are already difficulties, linguistic barriers already exist in our system. Unfortunately, it's already often difficult to access interpreters. And we know that can have real significant ill effects, adverse effects in terms of quality of services and ability to communicate effectively with patients. And those who are most likely to be affected are those who are not fluent in either English or French, particularly new arrivals, and more particularly refugees, asylum seekers, certain temporary foreign workers, sponsored family members, especially those who are older, and generally people, economic immigrants usually are obliged to have fluency in French, but it's not the case for a whole series of other newcomers. So those are the ones who are most likely to be impacted. Next slide. So our group, this is a group of various professionals, clinicians, researchers, coordinated by the SHERPA University Institute, where Naïma and I work. We've, since September, pretty much, we've been doing all kinds of things, submitting briefs, open letters, meeting with opposition party representatives, press releases, an open letter that for which we collected signatures, and perhaps some of you may have signed on to it. But there were close to 1,000 healthcare professionals and researchers and so on who signed on within a space of 3 or 4 days. And that was published in La Presse Plus on November 27th. It's been shared with all the members of the commission, as have our other documents. So both the government and opposition parties are well aware of the issue and well aware of the arguments that we've made at some length. What will come of it remains to be seen. Next slide. So to conclude the presentation, it is still possible to hope that changes may be made to Bill 96. It's particularly important to do so beforehand because the Bill 96 will include provisions, derogation provisions, also known as notwithstanding clauses, which mean that it will apply despite or notwithstanding the Canadian and Quebec charters of rights. So it will be very, very hard to challenge in court. So it's all the more important to try to convince opposition parties and the government to make amendments before the bill is adopted. As I say, the committee will resume in early February, and in the interim in January, we will be picking up again on the campaign. And the main things that can be done and that some of you may be wish to do, first, associations or even individuals, but particularly associations, can send a letter to the Commission expressing their concerns and, if you wish, supporting our request, which is an amendment. What we are asking for is an amendment that would exempt essential public services, and in particular, the entire health and social services network. And if you send a letter to them, I can share afterwards the information on how to do so. Letters sent to the Commission are automatically distributed to both the minister and government MNAs, but also and opposition MNAs who are members of the Commission. Another possibility is to raise concerns within our institutions and to ask them as much as possible to relay those concerns up the line. If the minister or deputy minister or whatever of health became interested in this issue and decided to bring it up within the cabinet, that undoubtedly would carry weight. We're also going to be doing a conférence causerie that will be primarily in French on January 13th at SHERPA. We're going to continue collecting signatures for the open letter as of January, and I'm sure there are many other things that could be done, but those are the main ones that we'll be focusing on. So thanks very much.
Thank you so much, Janet and Naïma. And we're going to open it up for questions. And I'm going to turn to Stephen, who has his hand up first. Please go ahead, Stephen.
Thanks, Kaberi. You can hear me okay?
Yeah.
Great. I appreciate the work you guys have done, and I think it's terribly, terribly important. But if there's one thing we've learned from this current government, they don't pay a whole lot of attention to minority concerns. I can also speak to the idea of having either the university or our hospitals a step forward, and I don't think that's going to happen. They feel, their backs are to the wall in terms of their dealings with the government. If you got any idea of what we can do as a group of, academic healthcare workers, researchers, that would potentially make a real difference. There's clearly we're not well represented at the CAQ. It's not like they're going to, there's ministers at the table who are going to be paying a lot of attention to our concerns. So what can we do that you think might make a difference?
Well, I mean, I think, so from our discussions with members of the two main opposition parties that are open to our concerns, so the Liberal Party of Quebec and Québec Solidaire. So on the most likely place where there might be some shift is the 6 months for immigrants, because pretty much everybody, even to some extent on the government, apparently realized that it's too short. Now, we have not really wanted to, I mean, we asked that it be longer, but we made the choice to not focus on that primarily because it's just, I mean, if it's for, let's say, somebody who has a health problem, let's say they've been here 2 years, and unfortunately they're not, you're meeting with the patient and the patient is not understanding, and you can see that they're not understanding, and it's really important that they do understand. well, maybe they should have learned French, but they didn't, so it's not, and particularly that's true, of course, for people who are older, those who arrive here, being brought by their children or grandchildren when they're in their 60s or 70s, well, the likelihood that they'll ever be fluent is relatively low. So, but still, there is some realistic probability that they might say a year instead of 6 months, or maybe even 2 years. I mean, so
I think that's completely unacceptable, though.
No, I'm just saying. So that's one thing. The other thing, however, although I'm not extremely optimistic, I do think that there is still a realistic. I'll say it otherwise. I don't think that the government has really sat down and thought through the implications particularly for the health and social services system. And in fact, they apparently keep on reassuring opposition members that, oh, don't worry, we're not making any changes. Well, that's, that's not what their law says. That's not, but they seem to think, because they haven't explicitly sort of changed the law on health and social services, that it will be okay. But, and this said, I mean, it's true that for bilingual institutions will continue to be able to provide services in English to anybody who speaks English. So that's, that's good. It's better than in other sectors, but it doesn't resolve the problem of people who don't speak either English or French, and it doesn't resolve the problem of other,
I'm sorry
the other institutions.
Sorry to interrupt, but one idea that does come to mind is Quebec was very successful in getting the Quebec Diabetes Association to come up with a position statement, which I thought was terrific. And certainly you wonder to what extent we could be reaching out to the various medical associations, research associations that we're all a part of, and putting together, a groundswell of support from professionals who work in this space.
So that was, I mean, perhaps that wasn't clear. That was one of my first major proposal of what should be done in January. So that associations, whether professional associations or whatever, you write a position statement, a letter. It doesn't need to be extremely lengthy or detailed. Essentially, it's setting out your concerns, what you think are the likely negative impacts in your professional sector, and asking that the health and social services sector and other essential services be exempted from these provisions. I mean, I can share some of the examples, but that's basically, and sending that to the commission. You can send it directly to the minister as well, but in any case, it will go to the minister if you send it to the commission. And I think that, yes, that's definitely the strongest intervention that in my view. I agree with you on that.
I'm just going to open it up to Miriam because she's been waiting patiently. Those are great points that Stephen brings up and that you're addressing, Janet. But we do need to mobilize if it looks like they're waiting till February. Miriam?
So first of all, thank you so much for this talk. I'm a speech and language pathologist by trade and a specialist in bilingual language acquisition in children. And so this is an area that, my former patients, it touches them. So and your first point that individuals can't learn a second language in 6 months, that's absolutely true. It's absurd to think that. But what struck me during your talk, or what I was thinking about, is what about speech and language clinicians? Like, what about speech and language pathologists? Best practices tell us that if you can do intern in both of the child's languages or in both of your client's languages, that's what you should do. That is best practices. Now, if if this law is applied to speech and language pathologists, there's also, by the way, some evidence that the same thing is true in psychology. Even when somebody's very proficient, psychological services and intervention is easier in the person's language, and there's evidence to support that. So essentially, this law is telling us medical professionals to go against best practices, and to go against best practices, you have to go against best practices. Otherwise, you could be sanctioned. But then you turn around and your professional body could sanction you for going against best practices because you're following, like, I don't understand, like, professionals, allied health professionals can't win. They're going to get sanctioned either way is essentially what I'm hearing. And that's really, really concerning, because we work really hard to make sure that professionals follow evidence, best practice. That's what we teach them. And is that how it's meant to be read, that it applies to interventionists and everybody?
All people who are employed in the public sector, and so far as interpreters, is if the interpreter is paid for by the public institution. But that's a great point, and one that others have also brought up, and one that I think would be very important to foreground, is to say that absolutely it would be requiring professionals to go against best practices, to go against their professional duty to their clients, to their patients. So yeah.
So Miriam, have you had an opportunity to contact your association and see if perhaps they'd be willing to put out a position paper or statement?
I've not. I have to be honest. I've sort of not paid so much attention to this aspect of the bill, but I now will. The OOH will give me. You will be getting an email and a phone call from me probably tomorrow, because it's just not acceptable. It's to expect professionals to go against best practices, to threaten them with sanctions if they don't go against best practice. It's confusing, and it's just wrong.
Mm-hmm.
Aside from the fact that it goes against human rights, right? Mm-hmm. It's just a basic human right that people should be able to get safe healthcare services. That to me is a basic human right, and being able to understand is part of that. So this is a human rights question, in my opinion, anyways. But thank you so much for the work that you do. I hugely appreciate it. Thank you so much.
So I wonder if there's anyone else in the meeting here that can think of an organization that they're a part of that might be willing to write a letter. That could be really powerful. Patricia, did you want to make a comment?
Yeah, I don't know exactly. That's it. That, the APQ, the Association des Pédiatres du Québec, who supported our letter and our report, which went to the Projet de Loi for, what's it called, when it was a National Assembly to approve healthcare for all kids, regardless of their migration status. They were supportive of that. And that's what I wondered, Janet, like, despite the fact that we have, a racist government in many ways, they seem to still have approved that one, where they, it seems like there is some opening to,
Yes, I mean, there are different tendencies within the cabinet, between Jolin Barrette, who's very much on the right-wing nationalist side, versus Christian Dubé or others that are much more kind of centrist. So, yeah.
Yeah, and so I guess to that point too, so like the APQ is one, Miranda and I were just texting as well, thinking like FMSQ, like, do we reach somebody there? But is that really, because we're and there's another letter that's circulating around the Children's Council that all of us clinicians at the Children's are going to probably sign to. But that's the thing, like, is this the way to go with all of these letters flooding to them, or is there a more kind of strong effort that beyond that we could do?
to be like a unified kind of voice, or just getting a bunch of associations to sign to that one letter, I guess, you know.
I think they're different. I mean, you know, in terms of which is preferable, I think I would tend to encourage people to go ahead with their own sort of specific associations. I think that's simpler given the very short time frame we have. Now, I think it would be really interesting if people could share that with me particularly, let's say, just CC me on that, so that and then we could perhaps do like a press release, towards the end of January, just before they pick up the the study of the bill again, and sort of say they're this different association that have come out with a position. I think that would probably be the most effective way of doing it.
Yeah, it would be nice if we could inform Janet. I sent her our letter from Diabète Quebec, but at least then you have that evidence. So I don't know if you want to put your email in the chat, Janet, and
but I'm thinking, because I also wanted to send the little summary of how to send a letter or paper, whatever, brief to the commission. So I don't know if you would be able to share that with people who attended.
So I'm not sure if everybody here is at core, but I'm gonna put in my email. So those of you who are not usually part of our core group or listserv, you can sort of indicate if you want the information forwarded to you, because that's really valuable to construct the letters. And I think it's important for us to realize that, yes, it's an issue for Anglophones and Allophones, but it's an issue for Francophones too, because our Francophone colleagues and friends also believe in justice and also believe in care of their patients and also believe in diversity of the society. And they are not one homogenous group, and they're all not all logos. And so, it would be, what I was touched by Diabète Quebec, and it's a group of us that are from various universities and various it's from different parts of Quebec, and there was no question. There was not one person who said. Most people said, "Gee, I had no idea that this was much like us." And I think that's the thing. People are hearing we're promoting French. That's okay, but not that we're suppressing the rights of other people. And frankly, acquiring a new language can take a generation. The parents may never learn. The kids certainly might. You're going to penalize them for that? It's quite something. Any other comments from anyone else? Anyone else thinking of their organization? Hopefully you're sort of Miranda.
Yeah, I just had a question about like CMQ and what's their stance on it, because the CMQ's role is to protect the public. They license us, but they protect license physicians, but protect the public. But there's the whole issue of informed consent with anything that we do. And so with the language barriers, you would think that the CMQ would be going a bit crazy with this, and I'm not sure they are. So I don't know if you know their stance or not, because I haven't heard anything from them.
From the Collège de Médecins de Québec, yeah.
No, I mean I think it would be really very worthwhile to get in touch with them, because they don't the different professional orders did not weigh in on this part of the bill. To our surprise, but perhaps they simply didn't realize it, or I'm assuming that's the reason.
Yeah, I'm not sure they know understand the implications of it and what it means for health professionals in terms of when we counsel families and patients and discuss options for treatment, if there's a language barrier, then there's no informed consent.
Yeah, and I mean, I know that we sent, Diabète Québec sent a copy of the letter to the Ordre des Infirmières and the Ordre des Pharmaciens. So hopefully, Mayada, do you want to go ahead?
Yeah, so thank you all. This is a great discussion. I just wanted to, I'm wondering if, Janet, you've come across any efforts that touch more on the human rights element, because I might be, I don't know, I guess personally very disturbed by this, that I'm not thinking it straight, but it seems to me like a lot of what you presented clashes directly with a number of universal principles around human rights of children, human rights of persons with disability. And I'm just wondering if the right kind of alliance is not just one that includes medical professionals, but also one that intersects with people who work in policy and who are able to interpret some of what, I don't know, I guess as a citizen, I see as potential illegalities in this, in terms of its clash with both Canadian and international principles.
I'm not sure I'm clear on your question. So, I mean,
so has there been any engagement of lawyers, policy experts in interpretation in this bill as in relation to its implications for patients and users of the healthcare system?
There have been, well, particularly lawyers who are specialists in human rights who have made comments about this issue. So in technical terms, the difficulty, as I say, is that the bill will have a notwithstanding clause, so that it applies notwithstanding the Canadian and Quebec Charter of Human Rights. So, but nonetheless, I mean, of course, one can say it is contrary to a certain number of basic human rights. In terms of sort of expanding or contacting other groups, yes, that would be good. Yes, I hope that we'll be able to do that to some extent. It's a matter of, I mean, I guess when I say we, I mean, I'm the only person working on this kind of, well, somewhat full time, and then there's a bunch of other people who just pitch in as they can. So we're relying to a great degree on networking. So if you know people, if I know people, yeah, like we're just trying to expand out as quickly as we can and to make people aware. This said, I'm very happy again to have people contact me and to share the information with them.
Yeah, and maybe if you can put your email in the chat there, Janet, people will. I guess we'll close soon, but maybe I could task everyone to reflect and think of one organization that they're going to approach to consider putting together a letter, because we're all part of various ones. So if that can be everybody's homework, that would be fantastic. And on top of that, in January, I think Janet will be sending out another letter petition to sign more broadly. So we'll distribute that too. But I think, the problem is that apathy, leads to authoritarianism, and this is where we're caught, and we shouldn't be. And this law is one of a few laws that I think many of us have big question marks about, but this one will affect our day-to-day. And it will affect a lot of our fellow citizens and fellow inhabitants of this province. So thank you very much, Naïma and Janet. And I'm sure everyone will be really happy to receive the materials. There's a question about sharing the recording outside of CORE. It just depends on where, right? I don't get where and how. So we can talk about that offline with Janet and Naïma. But Elena, if you have some suggestions, just email us and we'll think about it. It's like the Zoom bombs. I don't know what the impacts are. But thank you so much again, and we'll continue to be in touch, because this is a great example of research showing, what best practices should be, and then society constructing a situation where those best practices are prohibited. So it seems Kafkaesque, but this is what we're living right now. Thank you again.
Thanks so much to all of you.
Thank you.